Okay, so we'll start the process today in the event. My name is Sue Venables. I'll just be facilitating this morning's event. And as you know, we're here to talk about building better hospitals for the future, the exciting plan and proposals for services at the hospitals in Leicester. Just to explain how we're just going to run the event this morning, and then I'll hand over to some introductions to Rebecca Brown. So it's really your opportunity just to hear about the plan. So we'll show you a very short video. You'll be pleased to know there's not reams and reams of slide presentations. And then it's your opportunity really to either ask for clarity about different aspects of the plan that maybe aren't fully clear, so that you can then answer the questionnaire, or you can talk to people in your family, your neighbourhood, and any networks you work with, to ask us any questions that you might have, or to just put any constructive points forward that you've got about the plan. So it's your opportunity. We have got the facility today just for you to raise your hands so that you can put your mic on and have those more face-to-face conversations with colleagues that we've got from the clinical commissioning group, which is the group that buys and commissions services, as well as a range of colleagues in different specialist fields that can answer your questions. So I think it'd be nice if you can turn your mics on, but if you prefer not to, then there is the opportunity within the chat box, which we'll be monitoring. So I'll pause there before we show the video and introduce you to Rebecca Brown, the acting Chief Executive for UHL, University Hospitals Leicester. Rebecca.
Hi, it's lovely to be here. In fact, I feel very honoured to be part of such an exciting and wonderful programme here for LLR, Leicester, Leicestershire and Rutland. This is a great opportunity for all of us to really shape the new services that we will be able to provide going forward, to really get involved. I know it also brings a lot of hope at a time when we need that hope, knowing that we will be able to support businesses and local employment. This is such a very, very great opportunity at this time. It's also, I have to say how very, very proud I am to be here and representing such a great team that we have within LLR and within the University Hospitals of Leicester. They are a great team working tirelessly behind the scenes to support us go in the right direction with our transformation and our reconfiguration programme. And you will meet some of them today, but there are many others behind the scene working really, really hard. So lovely to be here and, you know, really happy to answer any questions that come from today and in future if you have them. So back to you, Sue.
Thank you, Rebecca. So I think we'll start the process now in just showing you a short video just to remind you, if you're fully aware, or maybe to introduce you to the first time to the plan. So Carl, if I can ask you to start the video, that would be great.
We want to spend £450 million on EHospital and maternity services in Leicester, Leicestershire and Rutland. This means the services provided at the Leicester Royal Infirmary, Glenfield Hospital and the General Hospital. We want to see improved patient care, better patient outcomes and have staff working in the best place to make this happen. Most of all, we want to deliver hospital healthcare that is fit for the future. This is your chance to find out more about what is being proposed and to have your say. This will help your local NHS understand what the changes would mean for you and help us make a final decision.
What we don't want is a health service that's designed only by the people who work in it. It's got to be designed by the people who experience it and use those services.
The proposals include 2 super intensive care units, one at Leicester Royal and one at Glenfield Hospital, with 100 beds in total. That's almost double the current number. modernise wards, operating theatres and imaging facilities. The first dedicated single-site children's hospital in the East Midlands, based at the Royal. And a new maternity hospital. Currently, there are 2 units on different sites, the General and the Royal.
Obviously, having 2 sites means that sometimes we're spread too thinly. When we're really busy, when we haven't got enough rooms or when we haven't got enough staff to look after the women, especially in labour, women need one-to-one care. We have to transfer activity from one site to another. So we would envisage that with a new larger hospital where we pooled the staff together, that likelihood would happen less often. The beauty of it is that they're going to be in one unit, and if there is an emergency situation, they can very quickly have access to the obstetricians and the neonatologists.
Under our proposals, Glenfield Hospital will become a major planned care treatment centre, with welcome centres to put you at ease and help you find your way around the hospital. These changes would enable us to separate emergency care and planned operations. This would help prevent treatment being delayed or cancelled when the emergency services are busy. More than 100,000 day case procedures and around 600,000 follow-up appointments take place every year at the city's hospitals. The move will free up capacity at the Leicester Royal Infirmary and help ease issues of access and parking there.
Let's take a patient, for example, who's having a planned daycare surgical procedure. They will receive their pre-operative workup on this site, so all the tests and things they need doing before the operation. They will have also been seen in clinic on this site. The decision made that they need an operation in the first place, then they'll come to this site, they'll have their operation and go home the same day, and any follow-up that's necessary after that will also be provided on this site.
Leicester General Hospital will become a community health campus. It would include facilities such as the Diabetes Centre of Excellence, a dedicated imaging to help GPs diagnose patients' conditions quicker, and a stroke recovery service with inpatient beds. It would potentially be home to a midwifery-led unit, which will be relocated from St Mary's in Melton Mowbray. This will make it accessible to more people and provide a better and safer experience for mums. Today's modern medicine and technology means many patients don't always need to stay in hospital to get well.
Over the last 30 years, the NHS has cut its beds by about 50%, which feels counterintuitive looking at the population growth. But when you take into consideration the change in medical practice over 30 years, so hip replacements used to come in and be in hospital for over a week. They're now staying in hospital for around 2 days. We've got sort of robotic surgery now and keyhole surgery, which means patients don't stay in hospital as long. And we used to prescribe bed rest for patients. We don't do that anymore either.
And for some conditions, you can be cared for at home or where you live.
If you need to be in hospital, so you need treatment or you need investigations that can't be done in the community, or, for instance, you're acutely unwell and you need the investigations doing straight away, hospital is the right place for patients. But there's certainly patients where their medical treatment can happen at home, and it's much nicer for the patient if you can have all the care investigations done in your own surroundings, done at local community hospitals with doctors, nurses coming in that will be the same faces that they see on a daily basis. It's about having safe care, but in the best way for the patient, the most suitable way.
At the moment, our hospitals and our staff, while doing their best, are spread too thinly, trying to provide 21st century services in outdated buildings with limited resources and opportunities for change. We want to achieve a service based on our future healthcare needs, not the legacy of the past.
Leicester's hospitals merged in 2000, and whilst that merger was very successful, it left one issue unresolved. And that was that many of our clinical services, the location of those clinical services is more a product of accident than design. They're split across more than one site. Our staff are spread thinly and our equipment isn't always in the right place. And that can lead to difficulties with staffing our services in the way that we would want to do optimally. I'm really excited by these changes. I think that this is a once-in-a-generation chance to provide care in Leicester, Leicestershire and Rutland that will be state of the art. We'll give patients a much improved patient experience, give them access to modern medicines, modern treatments in modern buildings. And I'm really excited by this, and I hope that people will be when they see the plans of what we're planning to try and do for Leicester, Leicestershire and Rutland.
You can see the proposals on our website and fill in a questionnaire to give us your views.
Okay, hopefully that's just given you either a reminder or a bit of an overview of our proposals. I'd particularly like to welcome, I think we've got 1 or 2 people who've previously joined other calls, so it's great that you're coming back perhaps to ask further questions or get further clarity, or maybe just share with us things that you think perhaps we've not considered with the plans. So I'm just going to introduce my colleagues now, so that you can put faces to names. So can I come to Rach now?
Good morning, my name is Rachna Vyas. I'm the Executive Director for Integration and Transformation for the 3 clinical commissioning groups across Leicester, Leicestershire and Rutland. And I think, just echoing some of what Rebecca says, this is an incredible opportunity to hear your thoughts and to get some insight into any questions that you need answering, so that we can complete the consultation documents with you. So very happy to be here and happy to take any questions. Thank you, Sue.
Okay, and Elaine.
Good morning. My name's Elaine Broughton. I'm the Head of Nursing and Head of Midwifery for Women's Services in UHL.
Thank you, Elaine. Justin?
Good morning, everyone. My name's Justin Hammond. I'm the Head of the Programme Management Office for the Reconfiguration Programme at Leicester Hospitals. That's
lovely, thank you. So it's really just over to those people on the call. Do, as I say, raise your hand. So if you just scan across the screen, or if you might have the buttons at the top of the screen, just press the hand button there, or do feel free to put anything into the chat box. So Howard, can I welcome Howard Marshall, if you'd like to pop your mic on?
Yes, hopefully the mic's on.
It is. Lovely, Howard. Nice to hear you.
Right. I should have raised this at one of the workshops last week, but I thought about the question afterwards. There's a lot of talk about transport or access to the LRI, and with the new acute centre being, when it comes on stream at the Glenfield, there was that was saying there'd be a lot less people at the LRI, meaning a lot more room in the car parking, etc., etc. The question is, what plans are there to do with the extra space that's going to be created at the LRI? For example, the eye clinic, which is straddled across the Windsor and the Balmoral, which can be a little bit chaotic at times, to speak from personal experience. So that's the main question.
You're on mute, Sue. Sue, you're on mute.
Who, me?
Sorry, I'm so sorry, Howard. It's a rookie mistake to make. I do apologise. So, Justin, would you like to come in there?
Yes, of course. Good morning, Howard. Thank you for your question. That's a sensible thing to ask. So at this stage, where we have got to is obviously the proposals give an idea of the services that we're proposing to move across the sites. And one of the big questions really is in relation now to what we understand of COVID. And as you may have heard in previous workshops, the aspiration that we really do as much as possible keep and the elective flow as far apart as absolutely possible, making the Royal site an emergency site and Glenfield predominantly for planned and emergency for planned care. Some of those questions around the eye clinic and particularly the emergency side of things are still being reviewed. So they're in the plans and we're looking at them. But in terms of getting to where we would need the space and what would happen and actually making that final decision, we won't know until we get outside of consultation and the full decision-making business case comes together, because we're hearing a lot of different views as we're going through the consultation, which is making us step back again and just double check that we've got everything correct. As you know already, the space at the Royal is we are kind of climbing over ourselves, and iClinic, as you've already explained, is a particularly busy area. I walked through Balmoral the other day and that there were queues of people outside again. So anything we do to kind of alleviate that pressure, make things better. But yeah, at the moment, we don't have any firm plans for the space because we've still got to finalise exactly which services are going. And we need to do that in a consultative way, so doing all of this. So no plans as yet, but we will certainly feed that back as in terms of the views that have come out of consultation. Does that answer your question?
Yeah, sort of. I mean, one of the, I think a lot, I mean, I fell for it as well. There's more than one reception area, depending whether you go to the Balmoral part or the Windsor. I mean, I've gone to the wrong one. And I've been there when other patients have done the same. So I don't know how that can be addressed in a shorter time. But yeah, appreciate your response.
So just coming back on that point, part of what you've described there is around what we call wayfinding. So it's about how patients easily or don't so easily in that case navigate around the hospital sites. And this is part of our plans in terms of really looking at the entire site at the Royal. We have too many entrances. You'd have heard Darren Kerr talk about this probably in a previous session. I think we have over 20 different ways that you can get into the Royal building. So the proposals for the new maternity hospital coming at the front of the Royal actually gives us a proper entrance, and we will try as best possible to route everyone through that entrance. And then we're looking at proposals about how we would then bring that into the centre of the hospital, which effectively would almost land it more or less where Windsor and Balmoral join. So actually, in terms of trying to find the clinic, it would make it a lot easier. So we're very mindful, both for the Royal and for Glenfield, about improving the way that patients are able to find their way around the hospitals. But particularly for the Royal, where it is a bit of a rabbit warren, these proposals should help us to improve that. But again, we'll be coming back to groups like yourselves in terms of patient partners and patient representatives to really ask, when we get into the design stage, what would make things better for you and the people that are patients and public that you're representing. So as we really do listen to you and try and improve things across the board for all patients. Okay. Thank you for your comment.
Yeah, I've got to disappear in a few minutes because I've got to go somewhere. So appreciate your replies.
That's great, Howard. Thank you very much for joining us twice now. That's that's good staying power. Thank you. So are there any other questions? Yes, Chris, would you like to come in? Chris, welcome.
Welcome, Sue. I just wanted to pick up on one of the points. I know this might be for a later stage, but about the signage issues. But I thought I might flag it up early, even though it might be a few years before you need to address it. That is that one of the big problems when developing the new A&E was that the signage during the development was very poor. So when different departments were moving around, no one seemed to know where they're moving to and how you got to them, including the staff at the hospital. And I just wanted to show that when it comes to that stage of the development, that there is people focusing on the need to keep the signs up to date and redirecting as different things keep changing, as they will do during that development.
It's a very important question, Chris, and I don't think it's too early to be asking those sorts of things and putting those sorts of points into the questionnaire as well. Is that another one for you, Justin?
Yes, I'm happy to take
you're
that.
today, you're really popular.
That's okay. It's a really valid point, Chris, and I think from the experience that we had with the emergency department development, we learnt lessons which we then played into the new intensive care unit that was built over at Glenfield. So we worked in a better way with our communications team and on the signage, so as we had very early plans about how people will navigate, particularly making sure that staff were clear, because obviously that's the first place that people will go to, but also to make sure that the what we call the hoardings, so the boarding that goes round the outside of the building works, that was all very clear in terms of arrows and navigating patients around the site. We understand for the Royal this is going to be a really big development. You know, if you look at the size of A&E compared to the size of the new maternity hospital, so we did really learn that we didn't get it spot on at that stage. I think we improved things for ICU quite considerably, but there will be an awful lot more planning goes into to these new developments once we get through to that building stage, to make sure we use the website properly, to make sure we use visual aids properly, because we can't afford to really have patients and public wandering around aimlessly and not knowing where they're going. So really valid point, and thank you. And again, that will be logged as part of the consultation, so we feed it in.
Thank you.
Okay, so is there any other questions at all from Chris at all on that? Any other?
Well, it's a bit more broader, more strategic question, really, which is this is a massive amount of money, and it's once in a lifetime, maybe, you're not going to get another fund. I just wondered, to what extent is this development seen as future-proofed for the following 10 years? Is this just catching up to what we need now, or is it going to be still what we need in 2040?
Again, a very good question, and it is a fantastic opportunity. Rach, do you want to come in here?
Thanks, Sue, and thanks, Chris. And that's a question we've been asking ourselves all through this process, actually. So we've done a lot of work with our local authority colleagues to make sure that we've got the population growth that we're expecting for this period that you've highlighted and beyond, actually, and also the types of housing that's being built and those types of demographic growth that we're looking at. So we've built our plans on the best information that we've got. And of course, people are living longer. They've got different conditions now. So you will have heard of this phrase maybe called multimorbidity, where patients have got multiple different conditions that we're dealing with, rather than single conditions that we would perhaps see previously. So all of the plans that we are building have taken all of that into account at the moment. But as you've seen, particularly through this pandemic, we've had to adapt the services as we've gone forward. So currently, yes, the plans take into account the growth that we are seeing, but of course that will change as our strategic plans grow across the local authorities as well. So if you think about North West Leicestershire, for example, they're going to see we're predicting an expansion far greater than previously expected. So we are building those things in as they get known across the health and social care economy. The main thing is that we are working together to make sure that we can take all of that into account, and we've done as much as we've got with the best data at the moment. With the population growth that we've got at the moment, that we are forecasting across the different areas of Leicester, Leicestershire and Rutland, that will really actually help us build the right types of services in the right buildings, and that's all part of this consultation process.
Okay.
Thank you.
Thanks for that, Raj. I wonder, Raj, while I've got you and we're just waiting for any other questions to come in, obviously a part of the consultation is really asking people their views and really trying to understand what opportunities there are on the Leicester General Hospital site in terms of the community hub. So really very much wanting to hear from you. Is there anything, can you just sort of elaborate on that area of the proposals and how we're keen to see people?
Thanks, Sue. So again, we've been hearing from our patient partners and public groups for quite some time about the general site and the fact that in that area of the city, particularly the city and the surrounding areas there, we don't necessarily have we've never had the opportunity to build something like a community hub. But actually, when you look at the population there, you look at the demographics there, you look at the health need, the health and joint care need, actually, we've got the opportunity to really develop something quite special, I think, and certainly something that will hit all the generations that we've got currently living in those areas. So we're seeking views effectively on what people would like to see there. So, you know, things that we've been talking about with communities thus far are having extra access to like a GP hub, so a much broader access to general practice on that hub, but jointly with diagnostics. So that means that you don't necessarily have to travel into the bigger acute sites if we can do things locally, but equally having a real centre of joint health and care services. So we've been talking to our social care colleagues as well. A lot of their information that's coming through from patient groups is that actually having services in isolation is not the right thing, because you can't have health without social care and so on and so forth sometimes. So that joint piece of work that we're doing is actually informing what we're hearing back from our communities, actually. So that's a really positive move, and I think the more information we get from what our populations want in that area, the better. So if you've got any, you or the people that you're representing have got any views on what you expect to the general site, they will be really welcomed as part of this process.
Thanks, Rachna. So Joe, I'd like to welcome your question, if you'd like to pop your mic on.
Yes, thank you. It's a question I actually asked 3 weeks ago, and you said you couldn't answer it at the time, but you were hoping to put the answer on the website, and I still can't find it. And it's really about future-proofing. It's about food, menus. There was an independent review of hospital food a couple of months ago, and it said that any major development should take account of hospital food. It had ideas like digital menus, dining areas in wards, and it would be a great opportunity. I realise that funds, you know, may not allow, but I just wondered if consideration had been taken of the report.
Okay, I'm sorry that we haven't addressed that. I will make sure that on our Q&As we're doing that. But if I just wonder who would like to answer that. Is that something, Rebecca?
I'm happy to come in here. So thank you, Jojo. I share with you, I think, you know, this is such an important element to patient care recovery, and we need to make sure that we're now offering the best we can, as well as when we come to our reconfiguration. So this is something that is dear to my heart. It's something that I've already been having conversations with only this week about, you know, what we can do and how we can really revolutionise our services. So we are still waiting some further updates on this. So that's the reason why we haven't come back on the website, and we will chase them. But please be reassured, because of course, you know, you've only got my words, but this is something that we will be looking at, not just for reconfiguration. This is something that we want to be looking at now.
That's great, thank you, Rebecca. Is there any other questions on that, Joe, or that you want to raise?
No, that's great, thank you.
Lovely. Okay, thank you. So I've not got any other hands raised at the moment, but I'm just conscious that we've also just got Elaine Broughton on the call. Just wonder if you just want to quickly talk about the exciting developments in terms of the maternity hospital.
Yes, of course. So, you know, this is something we've been working on for a long time in maternity, over many years, and we've had some quite comprehensive reviews over the years in our maternity services. We currently run them off 2 big acute obstetric units and a standalone unit at St Mary's. And for the use of, you know, over the years, it has suggested that for safety and better use of staff, it advised that we would run the services from one central obstetric unit. So this is how we're going forward with our plans, and we've opted for the unit to be based at Leicester Royal Infirmary, and the reason for this is because it has to be co-located next to emergency services, intensive care units, blood bank facilities, and vascular services as well, just due to the nature of obstetrics. But what we want to maintain as well is midwifery-led care services so that women still have a choice. So we will offer, alongside midwifery-led birth centre at the Royal, which will, have pools in every room, for women to choose which way they birth. And we will also have the option of the home birth service as well. And we'll also have the option of relocating St Mary's Birth Centre, a standalone birth centre, which is really well liked by the women over in Melton. And we want to offer that service to more women around Leicester and Leicestershire by moving it and relocating it more centrally, so that more women have the option to choose that way to give birth, supported by community midwives, teams of midwives in continuity of care pathways that they will know and support them through their birth and afterwards. And we would also like to maintain some form of community hub in Melton to carry on supporting the women in Melton with their postnatal care and with their breastfeeding support, and also checking their babies, antenatal services over there. So, we will still maintain all the community services over there. And, we're really excited about this. It's a great opportunity for us. And I've been in the service many years and I'm still really excited about it. Okay,
great. Thank you for that, Elaine. So I haven't got any more questions in the chat box, so I'll just sort of summarise. But if there are any last-minute questions, don't hesitate to raise your hand. Chris, yes.
Well, one of the questions I was thinking about was what lessons have you learned as a result of the COVID crisis, and are you expecting really to learn more from that, which might, over the next few months, which might feed into the strategic plans at the moment?
Yeah, really important question, Chris. Rebecca, do you want to come in there?
Yeah, very happy to. So these very unprecedented time has given us an opportunity to learn many things, and we need to make sure again that we're future-proofing our hospitals, not just for what we are having now, but any further different viruses or different issues that we face from an infection prevention control situation. So we are taking that learning, particularly around the use of side rooms, the use of space, and we are working again nationally with some of the other hospitals who have also, sharing their learning. Make sure that we're looking at how we provide our care in wards, acute areas, ITU, etc., to make sure that we are absolutely fit for those services going forward. Now, it is a challenge to do this because, of course, when we first put our programme together, we didn't know of COVID. So we are having to really reshape some of that. And this consultation process, of course, has given us the opportunity to ask lots of experts' advice and views on what we should be doing so that we absolutely get it right as we go forward. But, it absolutely will shape the services going forward on the back of what we've experienced.
Does that answer the question for you, Chris?
Yes, I suppose so. Yes, and like the idea that I think there's still a lot to learn probably when we look back in a year's time and see what happened, and there still might be more things that will come out from a national perspective, not just the local one. Yeah.
Absolutely, Chris. And I think, some of the basic things around side room usage, having areas for donning and doffing within ITU environments, there are some things that are quite easy to learn. But you're right, the scale of what we're learning, it's important that we really build all of that information together so that we make sure that, when we go forward with our wonderful buildings, they are absolutely the right bit, in the right shape, right support to ensure that we're offering the best services for our patients and also for our staff, because it's very important that our staff are safe at work.
Yeah.
Okay.
There's another question I had on a different topic, really, but maybe similar to the question about the food. Really, is it's the IT system and communication systems within the Leicester hospitals are really still a long way off from being really integrated, especially integrated into the primary care sector. And is this a programme of development which will be going along in parallel to the buildings, or is it kind of being held up a bit whilst the buildings side has been developed?
No, it absolutely needs to run absolutely alongside, because we have to build our hospitals appropriately, make sure they've got the right wiring, etc., for any new ways of working. So I am really proud of our EHospital, which is what we call it, our EHospital board, which is very much a clinically led board. We have some fantastic staff working and leading our EHospital programme, so that we can move into a very, very new way of working. And that connection with the community is very, very important, because, you know, we want our patients to have seamless care. We want to be able to see each other's information, so clinically people can really see, as Rachna talks about, the comorbidities of our patients, so everybody can see the whole holistic view of the patient, and that we can care for patients in that way. So absolutely running alongside and making sure we get this right. Justin, I don't know if you want to add anything else.
Are there any sort of targets or timescales to developing that IT communication system?
So, Chris, if you look on the website, on our Better Hospitals website, as part of our pre-consultation business case, we've actually got something called a digital roadmap, and that gives us a plan over the next coming years around the key changes that we expect to see moving forward. As you can imagine, some of the IT work has actually been happening before the reconfiguration plans were finally awarded the funding to take us forward. And one of those was electronic patient records. Now that work has already started in its planning, but actually will start to come into happening from next year going forward. And by 2022 should be in place. But one of the key things for us is the treatment centre, because that gives us the real big opportunity to exploit digital technology as far more than we have ever done before, and really give a very different feel for the patient when they come in through the front door. So some of the experiences that you might have, I certainly do have at my GP practice, where when you arrive, you can sign in on the touch screen. You don't actually need to talk to the receptionist. You put your date of birth in, and it automatically logs you for your appointment. Technology like that we just don't use very well in the hospital as it stands, but we will be using in the treatment centre. Another thing that we'll be able to do there will be not to have patients in waiting rooms waiting to be seen, that actually people will be able to wait once they've arrived at the hospital, to be able to log in when they enter the main area, kind of the welcome centre, if you like, to be able to say that they've arrived maybe on their phone, or another way of doing it through an app, and that they will literally get called 5 minutes before their appointment to then go up to a much smaller waiting area just before they go in to see their consultant or whoever they're seeing, rather than having groups of patients waiting in waiting areas. So linked back to your question earlier about things that we're learning around COVID, for example, the less time we have people together, the better it is. And the more timely we can be about that, and the better ways that we can do that, the better it is. So IT and digital IT really does give us that opportunity. We've got a really big IT kind of ambition around both hospital sites, but again for UHL in its entirety, as Rebecca's just said, around eHospital, and then obviously working with colleagues in the CCG, and that's really where that digital roadmap that I described earlier comes into force, because that does combine both UHL's aspiration for IT, but also the wider NHS for Leicester, Leicestershire and Rutland.
I haven't seen that. Yeah, good. Thank you.
Thank you for that. And it's an important question, Chris, and just to sort of remind people, as part of the consultation questionnaire, there is a question around digital, because, you know, whilst we know for a large proportion of the population they feel comfortable with it and it really supports, we also know that there are some areas of the population that it's perhaps not the right route through. So we need to understand that as well. So again, where you're maybe talking to people, whether it's online or offline, neighbours, friends, etc., to encourage them to put their views forward on the questionnaire on all sorts of things, including the digital. So just looking down, we haven't got any further questions at the moment. So I'll just do a summary, but if there's any last minute questions that people want to come in on, then do raise your hands. But I think just what I'd like to say is thank you so much for the questions, for the clarity, and if you've been on the calls before, for coming back again. That's really, really important to us. But also in your individual roles as a patient and a citizen in Leicester, Leicestershire and Rutland, if you haven't already completed the questionnaire, please do so. There's a lot of other information on the website, but also just share the opportunity with people, because this is a very, very much from us that plea for people to have the opportunity to get involved in the consultation. So thank you for joining today. Rebecca, do you want to come in?
Yeah, very, very happy to just again thank everybody for coming onto the call. It's great to have such good, interesting questions. It's so important that we have the opportunity to listen and hear what our public and our community need. There are things that they want to be addressed, and their thoughts, their ideas and their values. It's really very important to us. So on behalf of all of us, a very, very big thank you.
Thank you, Rebecca. And just to remind people, there's a thank you to people, those people who are working behind the scenes here, because they are monitoring, they are hearing your questions and making sure that is fed into the consultation process. So everything that you're saying today is also important to us. So thank you very much, and I hope that you enjoy the rest of your day.